Hello, my name is Shireen Ismail, and today I will discuss the recent salmonella outbreak at the Greenfield Farms. Greenfield Farms is a mixed-use agricultural facility producing dairy, poultry, and vegetables. In this presentation, I'll explore the transmission pathways, role of human, animal, and environmental, um, roles of humans, animals, and the environment, identify key stakeholders, um, and propose actionable recommendations using One Health approach to mitigate the current outbreak and prevent future ones. So just for some background, Greenfield Farms operates a small dairy processing plant and supplies milk and poultries to local grocery stores and schools. The farm is also located near a semi-urban area, so there's residential neighborhoods that border the farm. And recently, several residents, along with farm workers, reported GI symptoms like diarrhea, fever, abdominal pain, and the local healthcare providers noticed the spike in the last 2 weeks. Lab tests on patients revealed presence of Salmonella enterica in stool samples, and public health authorities are concerned that the outbreak could be linked to Greenfield Farms, given its proximity and interconnection between the farm and the community. So there are several key findings here regarding the patients, the animals, environment, but I'm going to go over it here in this slide over here where I'm mapping the transmission pathways. So let's start with unpasteurized milk. Uh, so the veterinary findings showed that many cows showed signs of mastitis. So there was signs of infection, and the necropsy of um, chickens that revealed the lesions consisted with salmonella infection, including the potential contamination of poultry products. Also, we know from the medical exam that many there about 15 patients were admitted for severe dehydration and diarrhea, all testing with salmonella infection. And these individuals all reported that they consumed unpasteurized milk. So either consuming contaminated poultry or dairy products is a foodborne transmission, is a method of foodborne transmission to humans. Next, the manure that is being used on crops that's untreated serves as an environmental contamination, as heavy rainfall led to runoff from the fertilizer into a local stream that's used for irrigation, along with recreational activities by community members. So this is also a direct contamination, a direct source of transmission to humans. And of course, we can't forget the human to animal transmission. So we have farm workers that are in close contact with infected animals or in contact with the environment, like the manure, and that may have facilitated zoonotic transmission. Also, human to human transmission is very possible too. Although in this case, a majority of the patients seem to have had an interaction with any of these other direct sources. So, the stakeholders include Greenfield Farm management and farm workers. So their job would be to implement biosecurity measures, improve sanitation, pasteurization, animal monitoring, and reporting of animal illnesses, and participating in training programs. Public health officials, they will be conducting epidemiological investigations, implement control measures, providing guidance to the farm and all the other stakeholders involved, like veterinarians, public health providers, and also receiving guidance from environmental agencies. Your veterinarians, of course, are monitoring livestock health. Local healthcare providers will diagnose and treat patients and report cases to public health authorities. Environmental agencies will assess water contamination and regulate waste management, and also manage land use practices. Community members can practice safe food handling and avoid contaminated water sources. So our immediate action plans would be to recall and halt the sales of unpasteurized milk. Immediately, unpasteurized milk along with poultry products. The next thing would be, or the ongoing thing would be to provide medical care to affected individuals and also put out public health warnings to community members about these contaminated products and the contaminated water sources. We also need to increase hygiene protocols on the farm, like increasing the health checks of animals and implementing manure management improvements. Other suggestion would be using a practice like ultraviolet irradiation of hatching eggs to sort out, um, to kind of rid them of pathogens in a way that wouldn't affect hatchability. But these are all things that can be worked out within the farm. Next would be to look at these long-term prevention strategies. So, of course, the first thing we need to look at is food safety. So this requires pasteurization of dairy products prior to sale. The Center of Disease Control and Prevention emphasizes pasteurization as an effective way of killing pathogens. We need to be looking at animal health, so increasing veterinary checks on a more regular on a regular system, also having vaccination programs and other practices for more disease monitoring can this monitoring of poultry has been showed to reduce signs of salmonella and therefore improving food safety. The farm can also increase biosecurity measures like establishing clean and dirty zones within the farm to prevent cross-contamination. The manure should definitely be treated prior to application, and because improper management can lead to environmental contaminations. So water and environmental safety are very important. We need to improve water management by creating buffer zones for proper drainage, preventing runoff, especially in circumstances with heavy rainfall like we saw in this case. And we and community education, like conducting awareness campaigns so that people know the risks of consuming unpasteurized products. And supporting all of this would be policy. So policies that enforce certain trainings for farm workers on hygiene and food policy, or implementing policies restricting raw milk sales can really help this entire process along. Uh, in terms of the One Health approach, this case demonstrates the importance of interdisciplinary collaboration in addressing foodborne disease outbreaks. By applying One Health approach, we recognize that the salmonella transmission at Greenfield Farms was not just a food safety issue, but also an environmental health, but also was an environmental and occupational health concern. So the veterinary insights helped identify animals as a primary source. The environmental assessments revealed that manure runoff contributed to the waterborne transmission. Um, so, and of course, public health authorities also played a really key role in tracking patients and coordinating this response effort. So this holistic approach really allowed for a more comprehensive and effective strategy to mitigate the outbreak. Challenges in this in coordinating among diverse stakeholders is that they can have varying priorities that can be complex. So an example of this would be healthcare public health officials might prioritize immediate containment, whereas farm management that have economic concerns um, about product recall and business sustainability. Additionally, enforcing new safety protocols such as mandatory pasteurization requires balancing regulatory action with community acceptance. Some residents might be resistant to these changes. Other challenges would be addressing environmental contamination. It's not just about farm practices, but we have to consider these unpredictable factors like heavy rainfall. Before this course, I primarily viewed disease outbreaks as a public health issue surrounded or centered on uh, human illness. However, this experience has deepened my appreciation for an interconnectedness of the human, animal, and environmental health, seeing how farm management practices directly impact local food safety and community health reinforces the need for proactive and integrated surveillance systems. I'd also highlight the importance of ongoing education of farmers, workers, and consumers to prevent future outbreaks. This case has solidified my understanding that solving public health crises requires not just medical interventions, but also environmental policies, agricultural regulations, and community engagement. Um, Thank you very much. So here are my resources that I used in the process of this case study. Thank you for listening.